Hello, my name is Ava Andronic, and I'm a student at Winston-Salem State University. I'm in their online RN to BSR program, and today I will do an examination of the eyes, ears, nose, and throat. And my guest here is Irina, and she agreed to let me examine her. Alright, so this is going to be kind of like a home health setting, so let's get started right away. Can I come in?
Yes.
Hi, Irina. Nice to meet you. My name is Abel. I'm a nurse, and I'm here to do a little examination, okay?
Okay.
Alright, so I'm going to close the door for your privacy, wash my hands for 30 seconds, put on some gloves. Washing hands, hand hygiene is very important. Did you know that 80% of the diseases that people get are passed down from touch? So it's very important to wash your hands. First thing I'm going to do is take your vitals, so let me have you step onto the scales. Alright. And 128, okay. And now if you can just, let me take your height, put your head back. Okay, good. Now how tall are you?
I think it's like 5 something.
5 something? Okay. Alright, and we have 5'7", 67 inches. Very good. Alright, so let me take your pulse, put this on your finger, turn it on, and let me take your temperature. Under your tongue. Alright, and it looks like your oxygen level is 98% and pulse is 83. 97.8 is your temperature. Very good. Everything looks normal. Now let's take your blood pressure. Lastly. Alright. Does your blood pressure usually run high, low?
No.
Low? Normal? Alright, so it's going to feel a little tight. Just relax your hand. Thank you. Alright, I have 105 over 78.
Okay.
Sounds like about your normal. Alright, so I saw your history. You had some anemia in the past. Any other medical history?
Yeah. When I was a kid.
When you were a kid, you had anemia?
Yeah.
Okay. No other medical history? Okay. Alright, so let's get started. So you're pretty healthy. Any eyesight problems? Any blurry vision? Any pain? Any problems seeing day or night?
No.
Okay. Alright, so when was your last eye doctor visit? Have you had one?
Yeah, it was like 4 years ago.
4 years ago? Any issues that you had? Any problems with your eyesight?
Not really.
No? Okay. So I'm going to do first test is I want to see how accurate you can see, how well you can see. And we'll do a swelling test. It's called, and if you stand over there, let me have you read from line 7. Close your right eye. Okay?
VRNOD.
Okay, good. Now line 8.
OZN. I can't really see them.
Okay. Alright, so you're about at 2032. Now let me have you close your left eye, and let's try it line 7.
VRNDO.
Okay. And then line 8.
OZNHS.
Alright, so you had a few of them wrong. So you're about at 2032. So it looks like there's some difference from 4 years ago now. Definitely make an appointment to see your eye doctor just to have follow up. Maybe you need some glasses. It looks like. Do you have any problems reading when you close up, when you read a book? Alright, so it sounds like nearsightedness, and a lot of people have it, but definitely you might need some glasses when you drive or see something far away. Okay? Alright, so I'm just going to look first, and then I'll do some tests with the ophthalmoscope, okay? So your eyebrows are even, your eyes, none of them are drooping. Pupils, iris, nice and moist, sclera. Pupils are about 4 millimeters, which is good. Let me just, let's do this. Check under your eyelids, nice and moist and pink, and your sclera is pretty white and moist. So I'm gonna do a couple tests. I want to see how well your pupils react. Okay, nice and brisk. Nice and brisk. Okay. And let me do this first, couple more tests before I look inside your eyes, just to see your vessels and the optic disc. Okay. So first test is I want to see how your muscles move. Your ocular muscles. There's about 6 of them. So if you look straight at me and just with your eyes follow my fingers. Good, good. Now I want to see your peripheral vision, how you can do. So close your right eye and tell me when you can see.
See.
Okay.
See. See.
Okay. Now the same with this eye.
See. See.
Okay, good.
See.
All right, very good. Now I'm going to check for your accommodation, how your eyes accommodate. So focus on my finger. Alright, so both pupils converge in and they're both equal size. Okay, so I'm just going to look inside your eyes. If you can just look straight at me. Okay, you see the red reflex and the disc is nice and creamy orange. Let's try this one too. Alright, red reflex. And no big vessels sitting there. So what I was looking for, if your the vessels in the eyes were thick and a lot of them, it would be a sign of glaucoma. Any of your family members have diabetes?
No.
Okay, that's a high risk. Glaucoma is when you have a lot of pressure in the vessels in the eyes, and they have a lot of the pressure is very high, and it can actually give you vision. You can lose your vision that way.
Okay.
Okay. But otherwise, your vision's pretty good, other than the Snellen test.
Okay.
So let's move on to your ears. Any problems hearing?
Not really.
Any swelling? Any drainage that you noticed?
No.
Okay. How about any ringing? How about does your head spin or the room spins when you get up or walk around?
No.
Okay, good. I'm just gonna palpate. Just tell me if it hurts.
No.
Okay, same here.
No.
Okay. So I'm gonna look side of your ears and your eardrum and see how that looks. See if there's any swelling. Okay. Alright. So I'm gonna pull up your ear a little bit because of the shape of the canal. Alright, and everything looks clean and good, and the eardrum is nice and shiny. No lesions or anything. The same here. Okay, same here. Everything looks good. Alright, so one more test, well, a couple more tests I want to do. Just check your hearing. First one is a whisper test. So let me have you close your left ear. And I'm going to whisper and you tell me what I whispered.
ABC.
Good. Now close your right ear.
1, 2, 3.
Perfect. Now I'm going to use this tuning fork and I'm going to do a Weber test. I'm going to bring it, hit it, and you should hear when I put it on your forehead.
Okay. Yeah.
Both ears?
Mm-hmm.
Okay. Now I'm going to do a Ryan's test, which I'm going to put it in the back of the ear in the mastoid, and then bring it to your ear.
Okay.
Tell me when you stop hearing it in both
Okay.
places.
Stop. Stop.
Okay? Oh. I can't even do it right. There you go.
Stop. Stop.
Okay, good. Usually, if you hear good, If your hearing is good, you'll hear it twice longer in the inner ear. So everything looks good with your ears. Now I'm just gonna check your nose. Everything looks symmetric. Bridge, no, any damage to your nose in the past?
No.
Any problems smelling?
No.
Okay, can you breathe normal?
Yeah.
You snore at night?
No.
Alright, let me have you breathe in and out. Okay, good. Nice and clear. Same here. Alright, any nosebleeds?
No.
Okay, so I'm gonna look inside to see if there's any swelling, any
Okay.
lesions or anything. You tilt your head forward more. Okay, good. Okay, nice and moist and clean. The cilia is good. You know what the cilia does?
No.
Those are little hairs in your ear, in your nose, and they stop all the infection. Like when it comes in, it stops it, and then when you sneeze, that's kind of part of the whole thing.
Okay.
It stops all the bacteria.
Okay.
I know you're a lady, but you still have
Yeah.
hairs. So nose is good. Any allergies? I didn't see any drainage. I'm gonna just check your sinuses right here. Tell me if it hurts.
No.
Okay, and over here too. Any pain?
No.
Okay, good. All right, so I'm just gonna look in your mouth to see any sore throat, any coughing up blood. Sore throat? You have a sore throat? No. Okay. Yes or no?
No.
Okay. Okay. Go ahead and open up your mouth. All right. Top palate looks good, nice and moist. Let me see under your tongue. Okay, and your teeth look good. Your lips nice and pink and moist. Say ah. All right. I can see your tonsils, very visible. Back of your throat, it's not red, just nice and pink. I'm gonna do what's called a dysphagia screen or swallow test. I'm just gonna have you swallow a sip of water and then tell me something. Tell me your name if you.
Arena.
Good. Now sing for me. I'm just teasing you. So everything looks good in your mouth. Your teeth are very pretty. Do you floss and brush your teeth daily? Very good. Very good. So that pretty much ends my exam. Your ears, they're good. No problems. Mouth, same. Nose, clear. Everything looks good. All like the shape and size and all the mucosa looks good. Your eyesight's actually pretty good, except your vision, nearsightedness. So definitely check up with your doctor, your eye doctor. Make an appointment to see him.
Okay.
Okay. It was a pleasure. Thank you for letting me examine you. Thank you very much.